All right, everybody. I have 5:30, so I'm going to get started. I really appreciate again you inviting me into your living rooms to talk about weight management. This is my most favorite topic, of course. So if I ramble, it's because I'm getting really excited talking about it. Of course, this is my field. So anything that I can do to try to help and spread the word that we need to, start trimming the waistline for our health is definitely something I want to talk about. So we're going to talk about, weight loss, the who, what, why, when, and how. But of course, I always like to give some statistics and some of the things that are really going on in the world just to give us perspective. Um, you know, being overweight and having obesity is a struggle. It really is. And every time I put up this slide from the CDC, it's going up and up and up rather than down, down, down. So when you look at the prevalence of obesity, we have 42.4% of our American population that does not have a normal BMI. And BMI stands for body mass index, and it's a ratio of how much we weigh compared to how tall we are. And it's a measure, kind of like a healthcare measure of how our weight is going up. And unfortunately, when we look at our kids' weights are going up as well. When you look at this, 12 to 19 year olds, 20, almost 21% of that population has overweight obesity. And when you look at global statistics, and that's really what I'm interested in because I do a lot of global work, the overweight, we've got about 1.9 billion adults that are overweight, and about 640 million of them have obesity. And over 340 million children and adolescents are considered overweight, obese. So, as you can see, this is a huge, pervasive problem globally that we just don't seem to be able to get a handle on. Even though there's more attention on it, there's more money and policy that goes towards it, we're still having a major issue. So, why are we having this issue? What are the causes of somebody that just can't lose weight or that just gains weight so easily? And I just put this little slide together. It looks kind of fancy, and all it means that these are the contributing causes of being overweight and obesity. So, yes, it is linked to physical activity or lack of physical activity, it's linked to our emotions. We have emotional eating, so our emotions might dictate our eating pattern, but the emotions also secrete certain hormones that might make us hang on to weight and not let it go. Then, of course, there's the diet and the behavior. We've got environmental factors. It's very interesting when you look at different research studies of people that live in certain environments and certain, even when we compare what's going on in the United States and China, et cetera, and we do kind of these studies, we see that the environment really has an effect on people's health. When you think about environmental pollutants that might be destroying the thyroid gland or disrupting our hormones, all of that is contributing to our weight. Also, what encompasses the environment is just how we market. So, just our food supply, our marketing. I mean, come on, this is the time now, like 5:30 on, when all the TV commercials are talking about food. Then there's the socioeconomic status that's linked to being overweight and obese. It's very interesting. I do a lot of lecturing overseas. So when I talk to, say, the Middle East or to India, we've got such a dichotomy. You either have malnourished, where they're really, really skinny and underweight, or you've got overweight and obesity. And it is linked to socioeconomic status. So poverty is actually linked to being overweight and obese, but so is having the financial means as well. So when you look at the United States, different pockets of the United States that might have higher levels of poverty, like in Mississippi and Louisiana and different parts there, there is a huge percentage of obesity and overweight because they can't afford healthful foods. So they might be relying on, fast foods or cheaper foods. So that's a contributing factor. Medical reasons. We can't discount medical reasons. So if somebody has diabetes, thyroid disease, hypertension, cardiovascular disease, sleep apnea, a lot of these medical conditions in and of themselves contribute to being overweight and obese. And what's very interesting is that on the flip side of it, having overweight obesity also causes these medical conditions. So it's both. Physiology, and this is the part that's really fun that we don't really understand yet, but the physiology of somebody that has overweight obesity is quite different than those of us that are lean. And that's been shown in the research a lot between the genetics, between the hormones, between the digestive enzymes. There really is a difference between somebody that has overweight obesity. And then, of course, genetics. We can't get away from our genetics. So if you are a child of two parents that have overweight obesity, there's a pretty good chance that you're going to be carrying those obesity genes that puts you at risk of obesity. And then what are the effects of people that have overweight obesity? Well, physiologically, you're going to develop conditions. There are over 60 medical conditions that are linked to our weight, and they're adverse, of course. So it affects every single organ system of the body. We've got 11 organ systems. So between cardiovascular, endocrine, musculoskeletal, you've got 11 of them. And overweight obesity will affect every single organ system. And that's pretty scary. It also has an effect on the emotions and the psychosocial concept of the person that suffers from being overweight and obesity. And I'm so sorry to say that there's still so much weight bias that's going on. It's so hypocritical. So even with advertisements, in one advertisement, you need to be a slim model, but then on the flip side advertisement, they're talking about, fast food and junky food. Even people that suffer from overweight and obesity, when they go to the doctor, there's even weight bias there. They're not even being treated the same way that somebody that might have lean body weights. It's really very sad, and it is pervasive too. Economic factors. Well, we know that people that suffer from overweight and obesity, they have a slimmer chance of getting that job that somebody that might be leaner will get the job. They can't get certain insurances. They can't get disability insurance or life insurance. So it definitely does affect the economic status of the person, and of course, quality of life as well. The other thing I just wanted to point out is that I know diabetes is just so linked to obesity that we actually coined a term called diabesity, just because it's so similar between both diseases. They're multifactorial, they're metabolic diseases. But when I teach my medical students, I want them to kind of think outside the box. And we know that obesity can lead to type 2 diabetes. We know that. But I would also venture to say that insulin resistance, which is not diabetes, actually leads to obesity, which leads to diabetes. So, which came first, the chicken or the egg? And I really think that having insulin resistance is a big pervasive problem globally that most of us don't even know if we have insulin resistance. And the way you would find out if you have insulin resistance is when you go to your doctor and you get a medical checkup. Maybe you don't have any diabetes, or at least you don't think you do. Hopefully, your doctor is testing something called the A1C, and the A1C actually is a measurement of your blood glucose over a 3-month period. And if you are at, a little over the cuff, just say normal A1C is a 5.6 and you're at a 6. Well, that might not necessarily be high enough to deem you as a diabetic, but it's definitely showing that you have some sort of insulin resistance and can lead to diabetes. And that insulin resistance, I'm telling you, it's very, very difficult to lose weight when you have insulin resistance. So I just wanted to show you those correlations. Now it's really sad when we see diabetes, because it is so on the rise, and diabetes unfortunately is a very devastating condition in and of itself, but it's going to lead to other conditions that can really reduce the quality of your life. It will increase your risk of cardiovascular disease, stroke, blood clots, amputations, gout, overweight. It's just a really sad condition. I also wanted to bring this up too, to show you that Having overweight obesity is not just food in, food out, calories in, calories out. No, it's also related to some of the medications that we might be taking to take care of some of the conditions that we might have. So, we talked about diabetes, but even when you look at some of these other medications, psychiatric meds, some of the antidepressants that we might be on, or anti anxiety meds, anti seizure meds, some of our steroid hormones. I can tell you from personal experience in March of this year when COVID was, running rampant, I am a very bad asthmatic and it became so bad that I had to be put on 3 steroid inhalers. I'm telling you, no joke. In 1 month, I gained 10 pounds. 1 month. And I'm a dietitian. I know how to eat. I didn't change my eating pattern. I didn't change my exercise pattern because I live out here in the boonies. So I'm able to go outside and exercise. So that just goes to show that these steroid inhalers were really affecting me systemically, which caused me to gain weight. And I'm not trying to relinquish responsibility. Of course, I shouldn't be eating, boxes of Twinkies, but that is definitely a contributing factor. Those of us that are on hormone therapy or even taking contraception can actually lead to weight gain. Certain antihistamines as well, even if you're taking a Benadryl or a Claritin and things for your allergies, again, that's going to change systemically how you might be losing weight. And then certain medications for hypertension. Now, of course, we have to look at diet as well. And unfortunately, when you look at the global world, because I always like to look at the world, poor diet is actually responsible for more deaths than tobacco, high blood pressure, and any other health risk. So, poor diet contributes to about 11 million deaths per year globally, which is really quite sad. So I wanted to just show you this. This is just some studies, some statistics from something called the Global Burden of Disease Study 2019. And I didn't put everything on there, but it looks at a comparative between different countries. And I can tell you, I mean, look at us, high income North America. What are we eating? We're eating lots of red meat. We're eating lots of processed meats. We're eating or drinking a lot of sugar sweetened beverages. We have a high percentage of trans fat in our diet, which isn't good, and of course, sodium as well. And what I didn't show you on this slide was we have very poor intake of vegetables, poor intake of lean proteins, and poor intake of fruit. So, as you can see, we have suboptimal diets on top of everything else. Now, I really like this chart because, I mean, this is what I do for a living. I talk to people about their weight, and most of us are on a diet. This is just older statistic. I'm trying to get a newer statistic. It's just not published yet. But when you look at different surveys in the United States from 2013 to 2016, look at the percentage of people that are dieting for weight loss. It's a pretty high percentage, and of course, there's a gender difference as well. And when you look at some of the things people are trying to do to lose weight, what are we doing? Well, some of us are trying to exercise more. Some of us are taking the portion control route by eating less. Some are trying to eat more fruits and vegetables and salads. Some of us are drinking more water, eating less junk food. So we have a variety of ways that we're trying to lose weight. Is one better than the other? No. We're going to talk about how you have to find what works for you because there is not one single perfect standardized diet that's going to work. You have to really find what works for you and you've got to make small changes. We have to be also realistic about our weight loss as well. And just to make a comment about this exercise and eating less, I can tell you that weight loss, although exercise is extremely important, so I don't want to minimize it, but it's more important for weight maintenance than it is for weight loss. So I can attest to this. I was cycling 100 miles a week and I did not lose 1 pound. I won't lose 1 pound until I modify my diet. So if you're planning to lose weight and you're just thinking, well, let me exercise more, but not change anything in your diet, I'm going to tell you, you're going to be a gerbil on one of those wheels just running around in circles. You're not going to lose weight. So quote of the day, though, is do not let what is out of your control interfere with all the things you can control. Okay, so we can't control our genetics. All right, it's for some of us, it might be a crapshoot. I mean, I know on certain side of my family, there's overweight. I can't change that, right? I can't change my genetics. I think the future which is very exciting, I think it's going to be in the near future, is something called nutrigenomics. And nutrigenomics is really looking at the individual genetics of a person and then making dietary recommendations based on that. We just don't have a really big database on that yet, so we're guessing a lot. But I can tell you that that's some hot science that's on the horizon, and some of us nutritionists are kind of dabbling in it a little bit. So, in order to be, effective to lose weight, the first thing I would say is join some sort of program. Even if it's an internal program. And what I mean by that is involve healthcare providers, involve your doctor, your endocrinologist, your primary care physician. Get a referral to a nutritionist if you need more structured diets. Get a referral to a psychologist, because I can tell you, being in the field for over 20 years, we know how to eat, but it's why aren't we eating that way? We're not just eating because we're hungry. We're eating because we're emotional. We're eating because it's a memory. We're eating for so many different reasons. So you might get the food portions down, but those, emotional things might be interfering. So it needs to be a team approach. Definitely get your gyms involved, get your fitness center involved. So it has to be a team approach. Now, I'm not a really big pill pusher, but I just wanted you to be aware of what some of the weight loss medications are out there. Um, and they could help. Again, this would be something that you would talk to your primary care physician about. This one is called Orlistat or Ally. This has been around a long time, and they all do various, they help you to lose weight by different mechanisms. So what Ally will do is it actually reduces the fat absorption of your body. The problem with that is that the person taking Ally would now have smelly, stinky stools, and they would be going to the bathroom several times during the day. And that's not, number one, very comfortable for the quality of your life. And number two, that can actually pose a risk to fat soluble vitamins. And now you're developing vitamin deficiencies that are bad. So, you got to, all of these things would have some sort of risk. The one that a lot of my patients are actually using is something called Contrave, and it's actually two medications that are put together. And what's interesting is that these are medications that are also used as antidepressants as well. And the way this one works is it actually suppresses your appetite. It takes away cravings, it takes away hunger. But again, there are side effects to it. I had one patient that just started it on Saturday. Forget it. She got so sick from it. She got so nauseous, she couldn't even get out of bed. So obviously that one is not going to work for her. Then there's Qsimia, and this is again another dual medication, phentermine and topiramate, and this one also suppresses the appetite. Unfortunately, for some people, it causes like tingling of the extremities, almost like you have neuropathy. So that's very annoying, and it also causes taste changes. So even when you're eating, you're really not enjoying it because it doesn't taste so good. Then there's another one called liraglutide or Saxenda, and this one is used a lot in the diabetic population or people that are insulin resistant. I believe it's an injection. I can't tell you how often they do it. I'm not sure if it's once a month. I'm not sure. But again, it's supposed to suppress your appetite, but also change your physiology where it's changing some of how you're using the glucose. So that's why those that have that stubborn insulin resistance, this one might be the choice. Then you've got the phentermine, which has been around a while. That suppresses the appetite, but for some people, that would give them a lot of anxiety and dizziness. And then last but not least, we had one called Belviq, but this one was just taken off the market, I think this past January, February. So the FDA took it off the market because we saw that it actually increased cancer risk. So, when would be a time to ask your doctor, hey, I think I need some weight loss medications? Well, first, you would have to qualify. If you were just a little overweight, if your BMI was 27, which is a little overweight, the doctor might look at you and say, you know what, the risks would probably not outweigh the benefit, would outweigh the benefits. So maybe don't do these. But if you have obesity, you've got stubborn obesity, you've tried many different things and it just, you can't lose weight, or you get to the point where you lose some and then it just keeps bouncing up and down, you might want to consider weight loss medications and discuss that with your doctor. Now, what's really interesting about these medications is that people that deal with, healthcare providers that deal with weight management, we view obesity and overweight as a disease. This isn't just because you don't know how to eat, because we do know how to eat. It's just that genetically, hormonally, etc., it causes our body to just really hang on to weight. So the approach to it is maybe pharmaceuticals could help. So just keep that in mind. Again, I'm not a pill pusher, but I think this is something that could contribute to some success in some people. But, I think the first thing you have to really ask yourself is, are you really ready to make changes? Do you have the desire? Are you just dabbling with it, or are you really serious about it? I've had people come to me, and they're paying good money, but I'm not Harry Potter. I don't have a magic wand that I can wave over your head and say, boom, here you go. Follow this and you're going to get to your goal. If you think that I'm just going to give you a meal plan and you're going to follow it and you're going to lose weight. It doesn't work that way. You actually have to contribute to your own weight loss. So in order to do that, you have to be highly motivated to do that. You have to have the desire to do that, and you've got to make some sacrifices. You do. If I'm saying to you, okay, well, I recommend that you get rid of your soda and you're not ready to get rid of it yet, well, then you're going to struggle a little bit, right? The other thing is, do you have the ability to do it, which is kind of like your motivation. What are your reasons for losing weight? Motivation is so personal. And what's very interesting is that our health usually isn't the motivator unless you got really sick. And that's what I actually see in practice. And I see that in the research as well. So, for example, we all know being overweight and obese can lead to diseases. And yet, that's not the motivator for us to lose weight until we have the disease and we ended up in the hospital. And, what we're trying to do is prevent that thing from happening. What motivates us, it's interesting. What I find that motivates us is I have people that are motivated by their kids. They want to be around for their kids, they want to be around for their grandkids. I have other people that are motivated by their looks. They want to get into nicer clothes. They want to do that. I have people that will say to me, my motivator is to get on a plane and travel because, I'm uncomfortable traveling because I'm too overweight. I have patients that'll say to me, I want to get into, I want to be able to cross my legs. So it's really interesting what motivates somebody. So you have to see what motivates you to make those changes. And only you can decide that. Nobody else can decide that for you. Do you have the needs and the commitment to do it? And will you actually activate your plan? Or will you just, shuffle around? Are you in the pre-contemplation stage? Are you actually going to put what you're supposed to do into action? Um, and of course, what are those steps? So, what are some of the steps to actually losing weight? The first thing I always recommend for my patients and my clients is get a medical checkup. If you haven't been to the doctor in at least a year, you got to go, even if it's a virtual checkup. Because once you start a weight management program, you want to make sure that everything else is healthy, number one. And number two, you want to see if there's anything in your health that might be impeding your process or progress. So, for example, maybe you don't even know that you have insulin resistance. So you go and you get a medical checkup and you realize, oh, shoot, I have insulin resistance. That's why I can't lose weight. So maybe what that's going to do, let me see. Maybe what that's going to do is actually inspire you to take care of your insulin resistance first, and then you'll start to lose weight. The other thing you need to do is you need to do a self assessment. How much weight do you need to lose, and how did you determine that? Are you in la la land thinking, okay, well, I want to be the weight I was in high school or when I was in the service? Okay, well, if that was 40 years ago or 50 years ago, I'm not trying to be rude, but we have to be realistic. We might be at a different time in our life. Also, if you lose too much weight that's not healthy for your body, number one, you're not going to maintain it. And number two, your body's going to fight you every step of the way to get to that goal weight. So you need to determine, how much weight do I need to lose? And this is something that you can talk to a nutritionist and a doctor about. And is it realistic? The other thing you need to do this self assessment is, are you going to give yourself enough time to lose the weight? I have patients and clients that will come to me and say, "Look, I have a wedding next month and I need to lose 50 pounds." Okay, yeah, that's not going to work. I'm very honest with my patients. And if you don't want to work with me, you don't want to work with me, but I'm not going to put you on some crazy diet where you lose 50 pounds and then you end up in the hospital. So you also have to say to yourself, how much time am I going to give myself? Am I going to take it slow and steady, or am I going to try to get everything off in 1 month? Because it won't work that way. Another thing you might want to consider is approach your weight from a disease centric approach. So, if you do have conditions like hypertension, diabetes, insulin resistance, sleep apnea, things that might be caused by your weight, try to approach it not from the weight, but from the condition. So, if you know, okay, I have hypertension, and now I have to take medications for hypertension. Maybe what you can start thinking about with your diet is adding more fruits and vegetables or going on a low sodium diet. So you're not thinking, all right, I want to lose weight so my blood pressure will come down. You're going to say, okay, I'm going to choose foods that might be healthier to decrease my blood pressure or not, at least not exacerbate it. And what that will do is actually help you to lose weight because you'll probably cut calories. Because if you say to yourself, all right, I got high blood pressure, I'm going to get rid of my McDonald's. Okay, well, you're getting rid of a lot of sodium and a lot of fat. And what that'll do is actually decrease calories, and you'll probably start to lose weight when we kind of take a different approach. The other thing is you got to choose an approach that is realistic and that can be incorporated into your lifestyle. I had a really great question last week when a member had said to me, "Hey, look, I don't really like to cook. I don't have time to cook. Can I do meal replacements?" I think that was a great suggestion. Yeah, absolutely. You can do meal replacements because that's what's going to be realistic to that person. The other thing you need to do is set SMART goals. I'm going to show you a sheet that I give my clients to fill out. I want to know what your goals are, and that'll also help me to determine, number one, is it realistic, and is it doable? And then you got to start making changes. And it doesn't mean make 20 changes all at once. The more changes you try to make all at once, the more you're going to set yourself up for failure. So maybe it's just about doing one thing. And I can tell you, I am extremely successful when it comes to facilitating change in my patients because I don't tell them what to do. I don't give them a meal plan and say, here, follow this. I follow your lead and then try to facilitate and help and guide. And I have a client that I'm working with right now, and he's about 350. When I first saw him, which was about a month ago, he started out at about 361 pounds. And so I've been seeing him for about 4 weeks, and now he's down to 354 pounds, which is great because not only is he losing weight, we actually stopped him from gaining weight. So that was two things. You first have to stop the weight gain in order to start the weight loss. So when he was talking to me, he said, "You know what? You're a dietitian. Your style is very different than what I'm used to." And I said, "Well, how so?" And he said, "Well, a lot of dietitians would kind of tell me what to do. Go on a low fat diet, give me a menu, and see if I can follow it, and what are the challenges. But your style is completely different." And my style is for him is I'll say to him, "Well, what are you ready to change?" Because if I tell him something and he's not ready to change it, you think he's going to change it? No, he's not going to change it. And then the next time I see him, we're all going to be frustrated because he didn't change it. So it doesn't make sense. So I said to him, "What are you ready to change?" So he said to me, "Okay, this is what I'm ready to change right at this moment. I am ready to not bring into the house any snack cakes." Okay, great. That's a good start. So he started to do that. And then the following week, I saw him again. I said, "Okay, what are you ready to change this week?" And what he was ready to change was he was ready to eat 3 meals a day because he wasn't doing that. So my point is, each time we're talking about what are you ready to change, and then you attempt it. And then you see what challenges arise and then you address it. And he's losing weight. Yeah, it's slow and steady. He's not losing 20 pounds in 1 month, and that's okay, but he's losing weight and he's feeling really confident and he knows that he's incorporating it into his lifestyle. And that's really, really important. The other thing you have to do is you have to self-monitor. You have to. Because if you think you know what you're doing just by thinking about it, you don't. And I'm not calling anybody stupid. I'm telling you right now, that is what's going to help you. I'm a dietitian. I think, oh, I know what I'm doing. I know what I'm eating. I can do a quick calorie count. And yet, when I self monitor, it makes me realize, wow, I was actually off a little bit. Now, it might not be by many calories, but I was off. It also motivates me because maybe I don't want to write in my food diary that I ate a box of ice cream sandwiches. So it actually might dictate my behavior. The other thing it'll do is, I kind of like graphs and numbers. I like that objective data. So I like to see, oh wow, I did less fat this week, or I did more protein this week, and that helps me to motivate. And the other thing it'll do is it will help you make the decision on what kinds of changes you need to make. Because the other thing I see going into this is people want to make all these different changes, and they might not be the changes that will actually inspire weight loss. Okay. And that might still be okay because maybe it's motivating you, but you also want to make changes that are going to be meaningful to your physiology to lose weight. And the only way we can really determine that is we need to look at the numbers. We have to look at the calories. We have to look at how much fat you're eating. We have to look at how much carb. We need to look at how much protein. So a lot of us approach this as, oh, I'm just going to go on a low fat diet. Okay. Well, how much fat are you actually incorporating in that low fat diet? Are you at 20%, 25%? Because a low fat diet to you might be 50% fat because now you don't go to fast food restaurants. Okay. Well, maybe 50% is still too much. So, my point is when you self monitor, it does drive the behavior, it does drive the decision making, and it really does make more sense. You'll be able to make changes that are more meaningful that'll help you get to your goal. And the other thing is you always have to reset your goals. They're going to change, so you have to make small little goals and then big goals. You make all different goals, and those goals change as we move along. I have a client that when she first saw me, she weighed about 232 pounds. She's 5'4". She, at the time that I first saw her, she was 68 years old and she walked with a cane. And she said to me, I want to be 120 pounds. Okay, well, I wanted to be realistic as well and say, look, if you go down to 120 pounds, you're going to look frail and you're going to lose all your muscle mass. Let's see how your weight loss progresses to see where you feel healthy at. So by the time all was said and done, she got down to about 170 pounds and she was feeling so great. She doesn't even need the cane anymore. She feels great. She looks great. She feels strong. So it's not 120 pounds, it's 170 pounds. But the point is, she's feeling really good and her health factor got much better. So that's why we have to keep resetting goals. All right, so let's just go through this a little bit deeper. So when you go and you get your medical checkup, I need for you to ask your primary care physician, look, I need for you to do certain labs. The first thing that your doctor will most likely do anyway is something called a CMP. And a CMP stands for Complete Metabolic Panel. And what that actually would tell me as a nutritionist is how healthy are your kidneys? How healthy is your liver? Do you have electrolyte imbalances? So it's really, really important information to have if you're going to start a weight loss program. I'll give you a good example. I have another client that I saw, and he got his labs done just like I asked him, and he got his complete metabolic panel, and he also got his lipids. Now, his lipids are the cholesterol, the LDL, HDL, and the triglycerides. And when I was looking at his report, I saw two things that I knew was going to stop him from losing weight. The first thing was his liver enzymes. His liver enzymes were through the roof. They were high, high, high. And his triglycerides were high, high, high. So that was telling me that he has a condition called fatty liver. And when I delved more into his diet, we found that he was a heavy drinker. He really enjoyed his hard liquor and he liked his sweets. And both of those things contribute to fatty liver. So instead of just putting him on a diet that wasn't going to work, I said, look, we need to focus on your triglycerides and your fatty liver. And once we get that under control, I do believe that we'll be able to lose some weight. Without taking care of that, it's going to be number one, very hard. And number two, I'm not really addressing his health issue. So he had agreed to he was still going to have some alcohol because he didn't want to cut it out completely, but he was going from about 5 drinks a night to about 1 to 2. And what that actually did was that made his triglycerides actually come down and his liver enzymes were coming down. And as soon as we started to do that, he was really motivated to do more changes to his diet and he actually started to lose weight. So it was really very exciting. So that's what I mean by taking the disease approach first rather than the other way around. The other thing I want to look at is, of course, A1C. I didn't put that here, but the A1C is something I would want to look at too, because that would determine if you have insulin resistance. I want to also look at something called the CBC, which is your complete blood count. And what that would tell me as a nutritionist is, do you have anemia? Because if you do, it's going to be very difficult to lose weight. And the reason why it's difficult to lose weight is because you're not oxygenating your body appropriately, and you need oxygen for your metabolism. You need red blood cells to also circulate all the nutrition and the nutrients. So if you have anemia, I want to take care of that first before we go into weight management. Otherwise, again, we're just that gerbil in a wheel going around in a circle. I want to take a look at your vitamin D. Most of us have low vitamin D, so I want to kind of correct some of these vitamin deficiencies that might be prevalent, even your calcium. Thyroid panel is very important too, because we know that the thyroid actually dictates metabolism. It does a lot of other things too. And it doesn't mean just because you have a thyroid condition that you can't lose weight. That's not what that means. I have Hashimoto's and, that's a thyroid condition, but I struggle a little bit to lose weight. But if I know that a client or a patient has thyroid disorder like Hashimoto's and they're taking levothyroxine, then what I have to focus on then from that disease centric approach is see if I can encourage them to get rid of sugar and get rid of alcohol. Because those two things would actually really make it hard to lose weight if you have a thyroid issue. The other thing I like to look at, of course, are your vital signs. So I want to see what your blood pressure is because again, I might approach it from that stance. So just to summarize, that's the reason why I want you to get a medical checkup. Number one, let's see what your health is like before we start making changes to your diet. Let's see if this will prioritize what we're going to talk about. Let's see if there's anything in your health that actually might impede the progress to lose weight. Because if there is, we're going to deal with that first. So that's why it's important. Now, the other thing we talked about was taking a self-assessment. Now, self-assessment means that you need to take some measurements. You really do. Because without measurements, how do you really know if you're losing weight? You could take, you can go by your clothes and by your belt buckle. You can do things like that. But getting that objective information should also be a motivator. I have some clients that'll come to me that will say, I don't want to get on the scale. Okay. So let's do a different approach. Maybe let's do a waist circumference instead. If you don't want to get on the scale, let's do a measurement. Maybe we'll measure your hips, or maybe we'll just calculate your body mass index, or maybe we'll do your body composition. The more numbers that you can get, I think that also drives your decision on what to do. I know your fitness center has that in body. Maybe talk to your fitness center on how you can do that. I think it's an awesome, awesome tool because it will measure your body composition, lean body mass versus fat mass. That could also help you decide what's your goal weight. I'll give you a good example. I have a patient that actually, let me see, she went from she wanted to lose some weight. She was about 202 pounds. Her goal was to get to about 150 pounds. But as soon as she hit about 165 pounds, we saw that her body fat was perfect. So she didn't need to lose any more weight. If she started to lose more weight, she would actually start to lose muscle mass. So it's really a great thing to know what your body composition is and also your waist. I think that's even more important than just getting a weight. I just wanted to show you this chart to show you that waist measurement is actually really recognized by the, medical field to see if you're at risk of weight related conditions. So here in America, if you have a waist circumference of, if you're a man, of greater than or equal to 102 centimeters, or for women 88 centimeters, that means that you are at higher risk of weight-related conditions because you're holding weight in your abdomen and your visceral area. And that means that's going to put you at risk of heart disease, intestinal disease, diabetes, etc. And what's really interesting is, again, through the research, we're seeing that different ethnicities, they actually change the waist circumference, the risk factor of the waist circumference. So this is just to give you an example of something called waist to hip ratio. So what you would do, and this could kind of be fun, you take your waist measurement, you take your hip measurement, and you just do the ratio. And at one time we knew that if you were a pear shape, in other words, you hold most of your weight on the bottom half, that actually puts you at a lower risk of weight-related conditions. But if you were an apple shape, we knew, well, that's a pretty dangerous body shape to have because of that central fat that you might be holding. Well, now we came out with a new fruit, and it's actually an avocado. An avocado shape actually shows that you are still at a moderate risk. So that means that you're kind of holding weight in both your visceral area, your abdominal area, but also your bottom area. So, this might kind of be fun to do instead of just getting on a scale. Take your waist measurement and divide it by your hip measurement. And if it falls within this risk, you want to be 0.8 or below, or 0.95 or below if you're a man. All right. So, for weight loss to happen, what kind of diet should you follow? Well, the first thing is, like I said, it has to be realistic. If I had said to my client, look, I want you to stop all alcohol, he wasn't going to do it because he wasn't ready to do it. So it was more realistic for him to go from 5 drinks to 1 to 2. Okay, so we compromised on that. The other thing that the diet has to do is it does have to produce some sort of calorie deficit. So, theoretically, if you decrease your calories by about 500 calories per day, by the end of the week, that's approximately 3,500 calories deficit, which is supposedly lead to about 1 pound of weight loss. Now, of course, there's a lot of variables. That's just theoretical, but that's kind of like the guide that we go by. Can we decrease our calories by about 500 calories, or maybe divide it? So we're going to decrease our calories by 250 calories and then increase our exercise to burn 250 calories. So the point is, by the end of the week, you have to have a calorie deficit. Now, where I see patients go wrong or clients go wrong is they work so hard to reduce the calories for that day, but then they blow it the next day, or they're just not consistent. And in our mind, we did so much sacrificing to reduce that calorie, but it didn't produce any effect because it wasn't cumulative. Weight gain and weight loss is the cumulative effect of behavior change. So if you just do 1 day, 2 days, you're sporadic, you're here and there, it's not going to work. Your physiology won't know what you're trying to tell it. It's not personal. It's a message that you have to give your body that you want to lose weight. So that's why you need to be consistent. So hence the question, can I have a cheat day? Because that's a question a lot of my clients will say to me. Well, can I just, have a good time on Saturday and not think about my diet? I can tell you that through the research, it shows that the more you allow yourself the cheat day, the higher the risk that you won't get to your goal weight nor maintain your goal weight. So, are you going to have a cheat time every once in a while? Of course. But are you going to have a designated weekly cheat day? It's really not recommended. You need to kind of stay on track the best you can. And of course, diet should be nutritious foods. I don't want you to cut your calories, but eat Twinkies all day. you know, Believe it or not, there are fad diets out there. There's the Twinkie diet, there's the cookie diet, and the whole point was you're going to eat cookies, but you won't eat enough cookies to make a lot of calories. Well, I beg to differ. Some of my patients actually do eat a lot of cookies and a lot of calories. The other thing that I wish that we can do, because really to make it realistic, is you need to get something called your resting metabolic rate tested. The ideal way to get it tested is something through what we call indirect calorimetry. But unfortunately, because of COVID, a lot of places aren't doing it anymore. So you can't go to the gym and do it. A lot of hospitals aren't even doing it either. And I just showed you this picture here, this crazy contraption. And what it does is it actually measures the oxygen and the CO2 interchange because, we breathe out CO2, we breathe in oxygen, and we use oxygen. So it actually measures your true metabolism. And the reason why that's so great is that if I know that a client has a resting metabolic rate of 1,200 calories, I know that if I put him or her on a 1,400 calorie diet, even though that sounds low, they're not going to lose weight because now they're eating more calories than their resting metabolic rate needs. So, unfortunately, there are a lot of places that don't do this anymore, but I can tell you that if you do the in body or any kind of, BIA measurements like that, they actually do measure your resting metabolic rate. It's not 100% accurate. It really isn't, but it's going to give you a really good idea of what your resting metabolic rate is. And that kind of leads you to, well, how many calories do you need? When you look at this crazy chart that was produced by all these, supposedly really smart scientists, I'm looking at it being a dietitian in practice, saying, are you telling me that my 19 to 30-year-old clients should be on a 2,000 calorie diet when they're sedentary? That doesn't even make sense to me. That's counterintuitive. And I can tell you that with my clients, if I put them on a 2,000 calorie diet and they're sedentary, they're not going to lose weight. So this chart is extremely skewed. So I never go by this chart. I never do. I can't really comment if doctors do, just because I know a lot of doctors might not have obesity management training. So they might not even know how many calories to recommend. So they might actually look at a chart like this, which is craziness. It doesn't even make sense to me. What I like to do if we don't have that indirect calorimetry is I have to guess. I do. So this isn't exact, but it would give me an idea of how many calories you might need. So this is just a quick calculation that we used to use in the hospital. If somebody wanted to lose weight, we would get their weight, obviously in pounds because we live in America, but I'd have to convert it to kilograms because everything really is in the metric system. And then I would multiply by 20. I'm going to give you an example. If somebody wanted to maintain their weight, I would multiply by 25. And there are some of my clients that need to gain weight. So I would actually multiply by 30 to 40 calories times their weight. So let's see if I gave you an example. So I use the same example. Somebody's 200 pounds, they want to lose weight. So I converted 200 pounds to kilograms. That's 90.1 kilograms. I multiply by 20, and that will give me or tell me that approximately 1,800 calories for that person. Now, again, it just gives me a ballpark because now I'm going to talk to that person and find out, well, are you a 75-year-old woman or are you a 35-year-old man? So, I can't just take this with a grain of salt. It'll just give me an idea. And then weight maintenance, I kind of, again, gave you that same 90.1 kilograms. So, as you can see, more calories. And then if you want to gain weight, it's a lot more calories. Now, if I really want to get technical, I just wanted to show you this just for fun. This is actually a calculation called the Mifflin St. Jour, which statistically gives me a really good idea of how much calorie I should recommend to somebody. It's actually been shown would be the calculation that I would use for most of my people if I didn't have indirect calorimetry. So this is just an example. So just say I have a 67-year-old lady. She's 220 pounds, which is that's a typo, 200 pounds. So I use the same example, 200 pounds, 90.1 kilograms. She's about 5'5". So when I plug it in, it's telling me that her resting metabolic rate is 1,400 calories. So as you can see, this is quite different, right? So with my 20 calories, I was already overestimating 1,800. So I was already overestimating almost 400 calories. And then it wouldn't work. So that's why this would be a better equation. So just to give you the insight of what nutritionists might do if they're calculating your calories, they're actually using an equation like this. Now, body mass index is an obnoxious chart, I have to say. What body mass index actually tells you is, do you categorize as overweight, normal weight, or obesity? So just to give you an example, just say I have a client that's 210 pounds and they're 5'2". Their BMI is a 38. All right, what does that even mean? Well, that would mean that this person is categorized as having obesity, stage 2, actually. So we want to be within 18.5 to 24.9. That's actually considered normal BMI. Now, the problem with BMI is, let's just go back to this. Just say I had a client that was named Dwayne Johnson, The Rock. I wish I had a client, The Rock. His BMI would be off the chart. He would probably categorize somewhere crazy, like definitely category 3. But obviously, he doesn't have obesity. He's got a lot of muscles, and muscles are very heavy. So that's the one problem I have with the BMI. I think BMI doesn't really tell you if you have obesity because you have more fat or you just are weighing heavy because you have a lot of muscles. So that's why you've got to look at your fat. Fat is what is going to cause you harm. So if you have obesity and you have a 40% body fat when you're supposed to have a 30% body fat, then you should truly try to lose body fat to get into better health. So that's why the in body is cool because it's going to tell you your body fat. So here I fall within this range. I'm 53 years old. I should be between 23 to 35% body fat. So if I was more than that, that might drive some of my goals because I don't want to think about weight per se. I want to get rid of body fat. And the way you get rid of body fat is yes, you have to reduce your calories, but you also have to reduce some of the foods that you might be eating, like the sugar and some of the simple carbohydrates, because your body absolutely loves to make fat from that. All right. So the other thing that you can do if you can't get to the InBody or the fitness center is you might also want to consider getting yourself a body composition scale. Now they're pretty inexpensive on Amazon. You just type in body composition scale, and it looks like a regular scale that you step on, but you have to program it. So it's going to ask you for your gender and your age. And if you have a pacemaker or a defibrillator, it's really not recommended that you go on a body composition scale because it does use a system called BIA, and it actually sends a little current up your feet to measure the movement. Okay, the other thing, like I said, which I had mentioned, this is consider approaching this from that disease centric approach. And this is really what I find to be more successful in the weight management world, and it also lets your guard down a little bit. We're very defensive when it comes to our weight. And I have clients and patients that'll say to me, look, I'm not going to that doctor anymore because he called me morbidly obese. Okay, well, when you look at the numbers, you do classify as that, but we have to be very sensitive. I'm not just going to say, oh, you're obese. So some people just don't like that terminology. But if I can approach it from, well, you know what? You've got high blood pressure. Are you ready to make a difference on your blood pressure? And sometimes that's definitely a friendlier way to go. And I do see that there are some questions in the chat. I promise I'll get to them. This is a really great chart that's actually this was actually printed by the American Association of Clinical Endocrinologists, and this was actually created this year. And they really like that, lifestyle therapy, disease centric approach. So they're saying, yes, we definitely need to focus on nutrition. Through calorie restriction, maybe you might want to have a plant based diet. You want to avoid certain fats. You want to have structured counseling, maybe some meal replacements, but you also need physical activity. So they're saying that also will contribute. And then don't forget sleep. We have to take this as a holistic approach. Believe it or not sleeping well actually causes a whole havoc on your hormonal system. And then it's really hard to lose weight. So maybe sleeping. And then behavioral support and smoking cessation too. So they're looking at just healthy, holistic ways that we can lose weight, but also help our health in the process. Okay, so the other approach that you're going to take is what's going to be realistic to you. Okay, so let's look at some of these diets because there are so many. There's the high protein, low carb. There's the low fat, low carb. Okay, there's the low calorie. So, one way that you could decrease your calories is maybe just looking at your macros. That's it. Maybe when you start tracking yourself, you notice that you're eating 1,800 calories, but 60% of that is carbohydrate. So maybe you're just going to focus on, okay, I want to decrease my carbohydrates, not go off of them altogether, but decrease it. So now you have to start thinking about, okay, what carb do I want to decrease? So you're looking at what you eat and you're drinking, and maybe the decision will be just to get rid of soda or just get rid of, some potato chips. Make some small but meaningful changes. I got to tell you, I have a client, actually, he's a patient, and when we looked at his food diary, he was drinking 700 calories just from his lattes. So that not only drove up his calories, it drove up his carbohydrate because he was using milk for his lattes. So the only change that we made was changing the milk to an unsweetened almond milk, and that cut out like 600 calories. So he was still able to enjoy his latte. It was something that he wasn't going to give up, but it decreased his calories and he was able to lose 10 pounds. And his goal was to lose about 15 pounds. And that was the only change we made. It was amazing. I have another client that we were looking at the food diary, and she just drank a lot of soda, regular soda. So she was doing about 4 cans a day. So we went from 4 cans to 2 cans. And as soon as we did that, that sugar intake decreased so much that her body became less inflammatory, and she actually had insulin resistance. It actually reversed the insulin resistance and she was able to lose weight. So I think my point in showing you this is that you don't have to go crazy, but you have to realize what you're doing and then make some sort of change. And if that change is not working, then you need to make another change, or maybe you need to make an additional change. The other thing you might want to consider is manipulating your eating pattern. Now, some people, there are different schools of thought. Some people are saying, okay, you absolutely have to eat breakfast. It's the most important meal of the day. But now, when we're looking at the research, sometimes that might not be the best eating pattern for everybody. So that's why intermittent fasting was really hot for a while. Because what intermittent fasting does is allow you to eat, but only within a certain time period. And there are different ways to intermittent fast, different programs. You have to see again what works for you. So I'll give you an example. I have a very high powered attorney that wanted to see me for weight loss, and he needed to lose a lot of weight. And one of his challenges was, well, he just didn't really eat right because he's either in court or he's preparing a deposition. His eating pattern was just so all over the place. So he decided that intermittent fasting was going to work for him because he did a lot of his cases in the morning. So he wasn't going to eat in the morning, can't eat while you're in court. And then he would start eating at lunchtime and then cut himself off at about 6 or 7 o'clock. And that kind of eating pattern really worked for him. So we started to do that. And then we also started to look at the types of foods that he was eating. So, again, you have to build it into your lifestyle. And that one actually worked for him. And he did tremendously well, tremendously well. The other approach that you can take is, do you want to restrict certain food groups? I have some clients that want to turn vegetarian. They're, look, can you teach me a plant-based diet? I want to get rid of some of these animal proteins and animal fats in my diet. Or I might have a client that says, look, I want to go gluten-free. Now, you got to be careful with gluten-free because gluten-free products sometimes are high in calories, but that's all part of the education. So if you want to go on a gluten-free diet, I'm going to teach you about what gluten is and what products there are. And then we'll come up together with a plan that might work. Or you might have I have patients that might or clients that might go on a paleo diet. So my point in showing this is that there's not one size fits all. It has to be custom tailored to what you're ready to do and what you can put in your lifestyle. And then once you start making the changes, you have to see if it's actually making a difference. Now, somebody had asked me, and I think he's still on the call. Dan, I think this was you. Thank you. So you had asked about the meal delivery services, and I wanted to just go back to some of my clients and some of my patients to see which ones they really liked. So that's why I got this list. They really liked the Hello Fresh. That's why I put that one first. But there are so many. A lot of them do deliver lean too. But these are just some of the names. You just type them in and Google them. They have all different price points. They have all different menus. And this is where you kind of, order what you want. It gets delivered to you. They're appropriate. They're portion controlled. Some of them will have diet to go is also good too. I like that one because it is calorie controlled. Some of them might also offer like keto diets or paleo diets or calorie diets, low sodium diets. So they might also add some of those things in there. And could this be incorporated into a healthy lifestyle? Absolutely. Definitely. Okay, the other thing maybe to get started is you need to start setting your goals. So I have a worksheet that I usually give my clients and patients and I say, "Okay, so let's start talking about your goals." So it stands for SMART because the goals have to be specific, measurable, attainable, relevant, and time oriented. So for specific, tell me exactly what you want to do. Tell me exactly how you'll track your progress. Is the change realistic? Do you want to get to a size 2 when you're a size 20 and you want to do that in a month? Okay. What do I need to do to make the change possible? Maybe you have to reach out for support. Maybe you have to, buy different foods. Why are you even making this change in the first place? Why is it relevant to you? Now, to your doctor or to your nutritionist, it might be relevant because I want you to get rid of your diabetes. I want you to get rid of your blood pressure, high blood pressure. I want you to get rid of insulin resistance. But that might not be what's relevant to you. To you, it might be, well, I have a family reunion in a couple of months and, I'm going to be seeing my cousins who haven't seen me in a long time. So that might be relevant to you. And then when are you going to start making the change? Are we just in the pre-contemplation stage or the contemplation stage, or are you actually ready to make the action, right? And what is your deadline to do the goal? So I just put an example here, and this is actually kind of, I modified it. So it's not exactly my patient, but I kind of changed it around a little bit. So for this particular person, they want to lose weight. That's their goal, right? So don't just tell me you want to lose weight. Okay, so specifically, this person, I will improve my health by eliminating soda from my diet. Okay, so we're not even thinking about the weight loss. We're going to eliminate the soda, and in turn, that's going to help them get healthier and also help them lose weight because they're going to decrease calories. Another, I want to lose weight. Okay, well, let's make it more specific. I will lose 2.2 kilograms by September 30th by replacing 2 bottles of soda with 16 ounces of water each day. Great. So now you're actually specifically saying, I'm getting rid of soda, but I'm going to replace it with water. And the reason why I like that is because if you say, okay, I got rid of my 2 sodas, but then you started drinking juice, that was counterproductive. That's not going to help you because now you replace the calories with the juice. So that's why this was a meaningful, measurable change. Attainable. All right, I want to lose weight. Okay, I will commit to reducing soda from 4 bottles to 2 bottles per day. Is it actually attainable? Well, hopefully that is. That's what you're going to have to decide. Is it relevant? I want to reduce my calories by reducing and eventually eliminating soda from my diet. Okay. And then finally, let me move this out of the way. Is it time oriented? I want to achieve my weight loss goal of 23 kilograms in 6 to 8 months. Okay, so that seemed to be realistic. You didn't want to lose 23 kilograms by next week. So sometimes I just give like a little worksheet like this. And the reason why it sounds so corny, like, why should I do this? But you, as the person going through and starting a journey, to actually write things down, that makes it tangible. That makes it real. If we just sit and I say, okay, yeah, well, I want you to lose 20 pounds because if you lose 20 pounds, your blood pressure is going to go down. That's not tangible to you. So when you start writing what your goals are and what you want to do, that becomes meaningful for you. And then I'm actually going to be coming up around behind you and saying, facilitating different questions. This is just a really great thing. I really like this worksheet. I don't use this for everybody, but I kind of copied different things from it. This was actually put out by the VA. And again, it asks very relevant questions to the person that wants to make the change. So once again, you start writing things down, writing your medications down. Let's see if there's anything that might be causing you to gain weight from your meds. Are you taking any vitamin supplements? Have you had any changes in your health over the year? Are you a newly diagnosed diabetic? That would be important information to have. What kind of support do you have? Maybe you want to diet, but your husband doesn't want you to diet because he's thinking, uh-oh, if you start dieting, that means you're going to change my dinners. All right. So you have to see who's your support system. So I think this is a really nice worksheet as well that they put together. I really do like it. All right. And then you got to start making changes. So, like I said, you got to start making changes, even if they're small changes. They might seem irrelevant, but cumulatively, they might be really good. So, maybe you can start out with portion control. I have a client that he didn't change any types of food he eats. He still goes to fast food, he still goes out to restaurants, but he just focuses right now on portion control. So I spoke to a client today that said, "Okay, I went to McDonald's for lunch or Burger King, wherever the Whopper is. Who has Whoppers? Burger King, I think. So instead of getting two Whoppers, a French fry, and a shake, he got one Whopper and a shake. So that was his compromise for portion control. So that is a really great start. When I calculated the difference, he actually decreased almost 500 calories just in that one simple change. So that was amazing. Now, eventually, we're going to get to changing different foods, but he's not quite there yet. The other thing are those food substitutions. So maybe instead of doing full fat milk, you're doing low fat milk. Instead of doing fried fish, you're doing baked fish. So you're doing different substitutions. That also helps too. And it's not irrelevant. Like I told you, that one patient of mine, he just changed milk to almond milk, and that made a huge difference. Eating pattern. Okay, take a look at what your eating pattern is. Do you wake up late, so you shift everything? Do you skip meals? Are you a snacker? Are you a grazer? Are these some things that might be contributing to sabotaging your progress? I can tell you just from the research that if you're a grazer, that will sabotage you. Because when we're grazing, that's more of an emotional type of behavior, or an environmental cue. You're sitting in front of the TV, you're sitting in front of the computer, you're bored, you're emotional, so you're grazing. So you might want to think about, all right, I'm not going to change any foods per se. I might just change my eating pattern. And then, of course, increasing activity in the process is always going to help you too. But again, always make sure that you're healthy enough to increase your activity. Don't just randomly do something and then hurt yourself. All right, another quote of the day: behavior change is typically a product of motivation, not education. And that is so true. We are so smart, all of us, plus we have the internet at our fingertips, but it's how motivated you're going to be to make the change. There are lots of different tools that you can use that are on the market. Just get on Amazon and put, weight loss tools, and you'll have portion plates. You've got this one I really like. This was actually something that the American Diabetes Association really promoted. It was just this little plastic thing that you would put on your plate, and then you'd fill. It would cause you to have portion control because you can't fill a lot in these little circles. So that was pretty popular in the day. I love these. I think this is just such a great way to portion control, just because, it's kind of a pain in the neck to just weigh things out and measure things out. But if you're using these little bento type containers, you're going to decrease your calories by decreasing your portion. And it doesn't mean you have to whip out a scale every time you do it. So that's why I really like this. This helps a lot of people. And then, of course, I love these bento boxes. And the reason why I love these is because the more you can meal plan, the better it is, because again, you're contributing to what you're eating. You're making that decision. I have a client that would email me, and she would send me pictures for the week. She would every Sunday she would make these little bento boxes for the whole week. So she would make her lean proteins like chicken and turkey, and then she would have her salads, and she would have a little space for her complex carbohydrates. And then I could take a look at it and say, okay, well, how about we change this around and change this around? So it was really a great visual as well, and lots of different things that you can use out there. And then, of course, what we had mentioned is you got to self monitor. Very, very important. So I wanted to show you some apps. I know most of us like the MyFitnessPal. I think it's very user friendly. You can either do it on your PC or you can do it as an app. The reason why I like MyFitnessPal is they have a huge database of foods. So even if you're, going to an Italian restaurant and getting, eggplant parmesan from Vito's. You can type that in and you can find something that's pretty close to that. Or it has a nice database on a lot of ethnic foods as well. Again, a lot of my clients have different ethnicities. So when you type in different ethnic foods, it shows up. I just love that. And it's free. There is a premium that you can pay for, but you don't really need to do that. But MyFitnessPal is nice because it also has a group. It has a community. It has, articles. It has recipes. So it's really nice. I like that. The other one I like is Barrytastic. That one we use for a lot of our patients at the hospital. You don't need a hospital code, actually. So if you wanted to log on to this, it's an app. If it does ask you for a hospital code, you just say no. And the thing that I like about this one is you can set reminder buttons. Like it'll tell you, okay, it'll ring and say, oh, okay, you need to drink your water. All right, it doesn't talk to you, but it'll ring, and then you'll know, oh, okay, I think I have to drink more water. So you can really goal set with this one. And then, like I said, lots of other ones that are free that you can play around with. So see what works for you. I personally use MyFitnessPal and Barrytastic. I use them both. So that's why those are top of the list for me. The other thing you might want to consider too, especially maybe in between the fitness center, or if you're not able to get to the fitness center certain times, you might want to think about some of those exercise apps that are there, because it's very motivating. And one thing that's motivating to a lot of my patients and clients is that they're very self competitive. I just love that. So when even if they wear a pedometer, and they're actually seeing, oh man, I only did 2,000 steps today. Sometimes it's like, all right, well, tomorrow I'm going to do 2,200 steps. So you can kind of be self competitive with yourself. And hey, if you've got friends that want to join you in this exercise adventure, that's even better, because then you can compete against each other. And, we Americans are very competitive. So that can actually motivate you as well. The other thing, like I said, is you have to reassess and reset. Okay, reset your goals. So if you're finding that one thing isn't working, or it was unrealistic, or maybe you're getting to the next milestone, it's always really good to kind of reset, reassess, always seek guidance and support. And you really need to enjoy it. You're never going to get today back. You're just never going to get it back, right? So you got to enjoy every single step of the way. Nobody is perfect. We're not going to look for perfection. You just need to see what you want to change and what you're ready to change. This is another thing I do have my clients and my patients do, is I have them take a picture of themselves at the beginning. You might want to consider doing it, because it's really interesting that some of us can't see the weight loss. I even have patients that have lost 200 pounds or 300 pounds, and they actually don't see the weight loss when they look in the mirror. They will go to the store and still go to the large and tall place of the store. So I think taking a picture actually takes you outside of your body, and you can kind of do a picture, collage of yourself. I actually do have a patient that actually she was on a weight loss journey, and she gave herself the year, and she needed a lot, she had a lot of weight that she needed to lose. So she took her baseline picture, and she took a picture once a month, just once a month, and she put it in a photo album. And she didn't look at the photo album until the year was up. It was amazing. And then at that year, she made it into like a party, a revealing party, and she was able to look at those pictures and really, really see that she lost weight and she put in all that effort. And it was just a really special moment. I just really love that. The other thing you can do is gauge by your clothes. I mean, I don't know about you, but in my closet, I think I have every single size. I have size for when I was in high school. I think I still have some jeans from high school too. Like, why am I holding on to that? But I have all different sizes in my closet. So maybe, there's a special black sexy dress that you want to get into, or a pair of shorts, or a pair of jeans, and you just can't quite get into them. Well, maybe that could be your gauge. So as you're losing weight, you get into those jeans, you just reached a milestone. Now it's all about reassessing and having a new goal. And then finally, just remember 1 pound at a time. Slow and steady wins the race. If you're losing a pound a week, that's 52 pounds, there are 52 weeks in a year, right? 52 pounds a year. Of course, you're not going to lose a pound every week. That's true. But again, slow and steady. All right, so that's what I have. I know I rambled, but let me see. I think there are some chat questions here. So I'm going to repeat them to you as I answer you. Okay, so one question from Peter is your opinion on artificial sweeteners and low-fat foods. Okay, so as a nutritionist, I'm supposed to say that there's no danger in eating artificial sweeteners. But I have to say that from the research, if you're trying to diet, some of the artificial sweeteners might actually cause you to gain weight. And it's really an interesting concept. It's counterintuitive because the artificial sweeteners don't have any calories, but the artificial sweeteners have been shown to change physiology. And there is research on this. I actually know one of the researchers that did research on, I believe, Splenda. And what it was showing Splenda was doing was changing the microbiome. It was changing your gut bacteria. And if you change gut bacteria, that's a hypothesis that causes gain weight. So if you can, try to get rid of artificial sweeteners and try to limit your natural sweeteners. As far as low fat foods, I think there's a time and place for it. Yes. So if I had a choice between, a 2% yogurt and a full fat yogurt, I'd probably go for the low fat. Now, I know with keto diet, they're looking at full fat with the premise that you're going to eat less of it because it's calorically dense and you're going to feel full. Well, I can tell you that in some of my clients and patients, that doesn't happen. Now they're driving up their fat, they're increasing their risk of heart disease, and they're increasing their risk of fatty liver. So you really have to kind of play around with that one too. And to play around with that, track yourself, see what percentage of fat you're going to allow in your diet, and then you start mixing and matching. Sometimes I have a full fat yogurt, but then I know the rest of the day I'm going to stay really lean. So I'm going to do like a vegetarian dinner. So you got to play around with it. I know I went around in a circle, but I hope that answered your question. All right, from Dan, is almond milk lactose free? Yes, it actually is. And how about lactate milk? Now, what's interesting about lactate milk is lactate milk is made for people that have lactose intolerance. And what that company does, the lactose free milk, is they put lactase enzyme in the product so it decreases the lactose. So that's how they make it lactose free. And what about diet soda like Coke Zero? Okay, so here's the thing about soda. Even though I'm supposed to say you can add anything into a healthy diet, that could be true. But remember that soda has some really dangerous properties. It does have phosphoric acids in them, which doesn't excite me for kidney health. It also has carbonation. Carbonation isn't really the best thing for your health either, even when it comes to dieting. Let's give you an example. So I have a client who was both overweight and suffered from GERD or reflux. And he drank a lot of soda. So the first thing we got rid of was the carbonation. He was ready to get rid of it, and we got rid of it. So not only did his acid reflux go away, he actually started to lose weight, and it was diet soda. So it really wasn't linked to the calories. What we think happened was the soda actually expands the stomach. That's why you drink carbonation when you have an upset stomach, right? Or you would have brioche. Remember brioche? You'd have it. It would have all those bubbles. It would help alleviate that sour stomach, because what it's doing is it's stretching the walls of the stomach. So if you're drinking carbonation, theoretically, you could probably eat more. So that's why I'm saying is, maybe that's the one thing that you can think about if you're trying to lose weight. Just get rid of your carbonation and see if that makes any sense at all. Healthy take out from Glen Eagles. I don't really know the menu, so that might be something we can discuss with Karen. Um, yeah, and thank you for mentioning the insurance. I think part of the yucky thing about insurance is a lot of them don't cover dietetic services, especially for weight management. It's such a crime. It's terrible. So maybe you can go back to your insurance company and say, look, I need help here. I need some more structured help. Maybe at least start with your doctor and see if they can give you a structured plan, and then kind of take it from there as well. Um, yeah, so let me just get your email. And this is Dan, right? Or Dan. Sorry, I'm mumbling. Let me just get the email and then we can move on to the next question. Okay. Okay. Can one can a day? Okay. Well, I don't know how many cans of soda you do, but if that's a decrease, I think you can do it. Okay. Let's see. Any other questions? Let's see. All right. Any other chats from you guys, or maybe unmute yourself and ask me any questions?
Hey, Lillian, it's Jamie.
Yes. Hi,
Dan
Jamie.
had asked a question earlier, and I don't think it was to everyone. I don't know if you saw it. I actually
Oh, tell
pulled
me.
it up. So it was about the he said so it is harder to lose weight when on antidepressant and anxiety meds. I'm also
Yeah,
a cancer.
it's not impossible to lose weight, but it might be a contributing factor on why you gained weight in the first place. So what we would do is we would just look at the dosage. Hey, look, we need to take meds. Okay, we're not going to say not take them, but at least we have the knowledge to say, you know what, that medication might be one of the contributing factors. So that would just help me to help you look at your diet even more intensely. Yeah. Nice question.
Thanks. Sorry, I wasn't sure if I deleted that because I looked at it earlier. So
Oh, yeah, I
thanks,
actually you're very
Dan.
welcome. So this is actually part two of our weight management lecture. Next week, we're actually going to talk about, okay, so you're on your journey. What happens if you're doing great and then all of a sudden you plateau? Or you're at your goal weight, how do you actually maintain it? Because maintaining weight loss is actually the trickier part, honestly. So I think right now everybody's homework is try to sign up for some sort of self-monitoring app. MyFitnessPal, Barrytastic, then start writing your goals. Actually write things down. What do you want to do? And then start really tracking your intake, even before you make any change. Don't make any changes yet to your diet. Track yourself, take a look at it so you can look broadly. Oh man, yeah, I do 5 sodas a day, or maybe I need to decrease the soda, or, hey, I don't eat breakfast. Maybe I can start breakfast. Or, oh man, I'm doing 2,000 calories. Maybe I can drop it by 200 calories. So I think that could be a really good place to start. How's that? All right. Did you have fun? I know I rambled a lot, but this is just a lot of fun for me, and I really appreciate you guys getting on the
You did
call.
great. You did great.
Oh,
Thank
oh,
you.
good. I'm glad you enjoyed it. And, I know holiday time is coming, and, we tend to overeat a little bit just because of holiday time. But I got to tell you, since COVID, we've been overeating. So maybe I think that's a really good way to just let's start. Let's start something. And that's a really good way to start. And also maybe, again, if you haven't had a checkup in a while, get a hold of your primary care and start, even if it's a virtual visit. Okay.